All right. Hello, everyone. Welcome. My name is Gary LaRue, and I am a health educator with the Northwestern Health Unit's IPAC team. Attending this meeting together with me is Stephanie Charles, who you probably are all familiar with. She's also part of the IPAC team. We also have Jory Kettles from Sioux Lookout's Menowowan Health Center. He is the manager of rehabilitation, chronic disease programs, and pharmacy services. So thank you again for attending. The purpose of this meeting today is to discuss the local pathway in Sioux Lookout, specifically for congregate living settings. As we move into like the respiratory season, we want to make it clear what options are available for antivirals and what pathways partners can go through to access them, as well as any related information we may have available. So with that, I will pass it on over to Jory.
Great, thank you. I will get some slides going. Hopes that, let's see here. You are probably seeing my presenter view, right?
Yeah, we can see both yourself and your screen at the moment. Okay, now we see just your screen. Oh, now we see just you.
Beautiful.
How's
Perfect.
that?
Great.
Okay. Oh, now what's happening? All right, so we can see the screen?
Yep.
Perfect. Yeah, so my name's Jory Kettles. I'm the manager of rehabilitation and chronic disease programs and pharmacy services here at Sioux Lookout Menowowan Health Center. So today I just want to talk a little bit about how to access antiviral therapy or treatment at Menowowan, specifically to COVID-19. Obviously heading into a respiratory season and already seeing a lot of respiratory conditions and prevalence taking place. Our primary focus has been on treatment options for COVID-19 as the government has rolled those out and provided very specific and detailed instructions for us. So just a quick sort of disclaimer that obviously this presentation is for information purposes only, and the information that I'm going to share today does not in any way supersede any information that's provided by a primary healthcare provider. It is very much recommended that you follow the advice and guidance of a primary care or emergency care provider, whether that be your own primary care provider, nurse practitioner, physician, or a medical director for your organization, or the doctor that you see in the emergency department. It's also really important to note that distribution of and access to these treatments has been led by Ontario Health and Health Canada. So we, as an organization, a provincial organization, we are required to comply with all the guidelines established by Ontario Health. So just for a little bit of background, obviously these treatments have come along in response to COVID-19. Health Canada has authorized, either under emergency authorization or standard authorization, the use of various treatments for COVID-19. The treatments that are available right now are for those who have confirmed COVID-19 infection only. And it's important to note that these treatments do not prevent COVID-19, but are intended to prevent critical illness from developing, or in the critically ill, it is intended to help combat an existing infection. As more research emerges, the guidelines have changed and continue to change since treatments have rolled out a little over a year ago. The changes, especially in the early days, the changes were coming in hot and fast. no sooner do we roll out a new set of guidelines and then new evidence emerges that changes the course of treatment and new guidelines come with it. So things do continue to evolve. The Ontario Science Advisory Table was publishing and updating treatment guidelines according to the best available evidence. That Science Advisory Table has since been dismantled. So to be completely honest, I'm not sure where guidelines will be coming from moving forward, but certainly as new evidence emerges, it will be communicated out to organizations, hospitals, clinics, primary care providers, etc. And as I said, distribution of these antiviral therapies has been controlled by Health Canada and Ontario Health to ensure equitable access to those most vulnerable and at highest risk. So recognizing that we are reaching out across a wide geography, different communities, again, particularly in the early days of treatments, the criteria were very, very fixed, very limited, an attempt to try and make sure that those who were most vulnerable to severe COVID infection had access to the treatments. So these are what the guidelines look like. This I've just thrown in here as a information purpose only. For adults, there's a 2-page guideline that stratifies patient based on their vaccine status, number of vaccine doses, and their age as being at higher risk or at standard risk. So helps determine who is or is not eligible for treatment. And there is specific guidelines for those living in long-term care that sort of follow a similar format, but are specific to long-term care and make access in long-term care a little easier as well. So again, long-term care is 2 pages. So specific to COVID-19, we have 2 different treatment options available to us here in Sioux Lookout, and they are intended for mildly and moderately ill individuals. So the first treatment option is called remdesivir. It's an intravenous medication, so it's delivered through an IV pump, and it's 1 infusion per day for 3 to 5 days, depending on a number of factors. Will sort of dictate whether you're looking at a 3-day treatment or a 5-day treatment. And in order to qualify for remdesivir, you should be presenting to primary care within 7 days of symptom onset. The second option is called Paxlovid. That's the brand name. It is a combination of nirmatrelvir and ritonavir. So these are some pills. You take 2 or 3 pills twice per day for 5 days. And the 2 or 3 depends on which dosing you are prescribed relative to your kidney function or eGFR. So for those who have mild to moderate impairment of their kidney function, they will be prescribed, typically would be prescribed a different dosage than somebody who has largely healthy and mostly fully functioning kidneys. With Paxlovid, you must present within 5 days of symptom onset, so certainly a narrow window. And Paxlovid has certainly become the preferred option for treatment, I think mostly because it's oral. We can prescribe it, it can be dispensed from your pharmacy, and you go home and take the pills for 5 days rather than having to come back to a clinic or to a hospital for an infusion for 5 days. So Paxlovid has been the most preferred. However, with Paxlovid, the eligibility requirements are a little bit tighter. The eligibility for both Paxlovid and remdesivir are a little bit tight. So you should be immunocompromised, 70 and older, or 60 and older with less than 3 vaccine doses, or 18 and older with less than 3 vaccine doses and at least one of the risk factors listed. But specific to Paxlovid, where this sort of big but comes into play is with the drug interactions. So again, while it is the preferred option, there is a huge list of drug interactions. So the prescribing doctor and a pharmacist do have to work together to determine if the individual, whether they're from a long-term care setting or community setting, the emergency department, we have to determine if the patient's medication regime will allow for Paxlovid. There are a lot of really common meds on this interaction list. So things like Lipitor, Xanax, Plavix. There's some other common ones here. Crestor, Viagra. These are all quite common, and some of them are even an over-the-counter or herbal remedy, such as St. John's wort. It's actually contraindicated within 14 days. So it's really important that any patient or any individual who is seeking COVID treatment, that they make sure that whether they're calling their physician, going to a clinic, or presenting to the emergency department, it's really important that they bring a complete list of their medications with them. And this includes anything that is over the counter or considered natural or traditional. So I guess the key piece of information here today is just how exactly you access this treatment in Sioux Lookout. So if you can sort of follow along with my little process map here, on the top left-hand corner, we see that if an individual is sick, the first thing to do is try and figure out whether or not they actually have COVID-19. So if we're not sure whether they have COVID-19 or some other respiratory infection, we can always contact the assessment center and arrange to come in for testing at our assessment center here at the hospital. If you do a rapid test at home, or if you have come to the assessment center and you know that the individual that you're questioning, you know that they do in fact have COVID, then we sort of have two different routes that we can take. So if you have access to a primary care provider in Sioux Lookout, chances are they're going to be through one of the clinics, either the Hugh Allen Clinic or the Northern Appointment Clinic. If you have access to that primary care provider, the preferred route is that you go through your primary care provider. Give them a call, see if you can get an appointment, which I know is quite challenging with both clinics. In other congregate living settings, long-term care, or otherwise, if you have access to a medical director or the resident's physician, then you can consult with the physician or medical director for some additional guidance. But ultimately, if the individual is seen by primary care, it's up to the primary care provider to determine the course of treatment. So whether the patient is even eligible or not for COVID-19 therapy, and then which of the two medications, whether it's Paxlovid or remdesivir. So if it's Paxlovid, the primary care provider should work with the pharmacist, as I said, just to really confirm that the patient can take Paxlovid and work on adjusting the patient's sort of current medication regimen. Prescriptions for Paxlovid will be sent to a retail pharmacy. All the retail pharmacies in Sioux Lookout do have access to Paxlovid, so it will be dispensed and I think typically available same day. So this avoids you having to come to the hospital whatsoever. Now, if the primary care provider determines that remdesivir is the best course of action, then the individual will have to come to our emergency department to actually be reassessed again and then have that infusion done in our emergency department. And it might, the actual infusion might take place in the emergency department. It might take place in our day medicine clinic, but either way, the pathway in is unfortunately through our emergency department. Now, if a patient does not have access to a primary care provider, so we're sort of back to the middle of the screen here in the middle of this flow chart. If they don't have access to a primary care provider, that's okay. They can still have access to the treatment, obviously. They just access it through our emergency department. So again, presenting to our emergency department, triaged by one of our nurses, seen by the physician in the emergency department, who will do an assessment to determine which course of treatment is best. Again, if Paxlovid is determined to be the best solution for the individual, then the physician will prescribe it, and the medication will actually be dispensed right from our emergency department. So the patient or the individual will leave our emergency department with a small box with the pills that they need to be taking for the next 5 days. No need to go to a pharmacy. And if the ER physician determines that remdesivir is the best course of action, then they will potentially initiate treatment that day. Sort of depends on the time of day that the individual is presenting in the emergency department. The tricky thing with remdesivir being an IV infusion is that it actually has to be mixed in the pharmacy, and our pharmacy staff only work Monday to Friday, 8 to 4. So the physician will make an assessment on whether or not the remdesivir can be initiated immediately, or if it can wait until the next day. And then we will, if we have to, we call in pharmacy staff to mix the infusion and make it available to the patient. Subsequent infusions, again, they might take place in our emergency department. They might take place in our day medicine clinic. Sort of just depends on the flow of traffic. I guess I'll just pause for a quick second here and ask if there are any questions.
So just maybe to clarify, so if a local congregate living setting, and I'm thinking like smaller ones that maybe aren't long-term care, because those are usually linked to a healthcare provider and can normally maybe offer more of this within their own setting. So like maybe more like a group home or a shelter or community living. So if they're coming to you with a client who has symptoms, whether or not they've been to the assessment center or not, if they come to the emergency room because they're not linked to a doctor, should they be saying anything like, or like presenting, maybe giving you guys the heads up that they have a potentially person with COVID or COVID symptoms? Or is it just normal like screening at the entryway?
Yeah, so when you enter the hospital, we do have our screening kiosks. So the individual and their escort, if there is one, can both screen and grab a seat in the waiting room, and then they'll be triaged by the triage nurse, and will disclose the symptoms that they're feeling. The triage nurse will assess and make a determination of whether or not the patient gets placed in a specific area of the emergency department for those with COVID or suspected of having COVID.
Awesome. And so I'm assuming like there's different situations, right, that can happen. Like maybe they've been to the assessment center prior and then their symptoms worsened. But that would be something that the hospital also could arrange if they just for the confirmed test, like to get the confirmed test to be eligible for treatments. Or should they go first to the assessment center? I guess it depends on symptoms, right? But
yeah, so it certainly depends on symptoms, and that's.
But preferred if it's possible and if it's preferred for them to go to the assessment center, I guess, prior.
So if they have a primary care provider, let me back up here a little bit. If they
Go
have
there first.
care provider, the preferred route is to go through primary care, just
Okay.
Just so that you're not having to come to the emergency department. You're not having to potentially sit for hours in the waiting room waiting to be seen. Some days our emergency department is very, very busy. Other days it's a lot faster. It's less busy. You can get through pretty quick. But ultimately, if you have a primary care provider, it's preferred that you go that route first. Now, your primary care provider, before they can prescribe one of these treatments, they need to know if it is in fact COVID that they're dealing with.
Right.
So that's where that phone call and trip to our assessment center is preferred.
Gotcha.
Or again, if you have rapid tests, if you're at home or in a congregate living setting and you have access to rapid tests, or like the ID Now tests or something like that, those are acceptable as well.
Perfect. Thanks.
I think any other questions? So regardless of pathway, I think at the end of the day, if you have any of these sort of more severe symptoms that you're experiencing, best to just call 911 or come straight to the emergency department. Don't have to worry about which pathway and primary care and that kind of stuff. Just at this point, it really does sort of constitute a medical emergency, and we'd rather see you access care, period, and are less concerned about how you access the care or which pathway you take. Just make sure you're going to your emergency department. So there's lots of tools and resources available. If you're looking for more information, we recommend that you stick to the Ontario COVID-19 website, as well as Health Canada's website for information on treatment options. There are many other treatment options available, but they are typically a lot more sort of serious treatment options that would be administered when somebody is critically ill and hospitalized. So there's other IV medications, just tocilizumab, that are typically for the critically ill or the more seriously ill. So if you were to get admitted to hospital, then that's a whole other pathway and a whole other set of treatment options that are available. But our sort of first line for those who are mildly ill, but at risk of becoming severely ill, is these two treatment options discussed today. So the remdesivir and the Paxlovid. And otherwise, if there's no further questions, I think that's all the information that I have for you. Just want to say thank you for the opportunity to talk about this today. And if anybody has any questions or concerns or needs help navigating the system, feel free to reach out. My contact information is there. Again, just know that things do continue to change and evolve. So what we've discussed today may not necessarily be the pathway and the route and the option that is available, next week.
Well, thank you. That was a really in-depth presentation. That was really good. One quick question while we have you here. Do you know what your holiday hours are going to be for this season?
For the assessment center?
Yeah.
Not off the top of my head.
It's okay. I can look them up when they're posted, and I'll forward them to the participants.
Yeah, I'm certain that they are posted. I know we just finalized our holiday hours for all departments. I don't know off the top of my head. But of course, I would expect continuing with Monday to Friday 8 to 4, with the exception of the statutory holidays. So over the holiday season, easiest point of access may just be through the emergency department.
Okay, perfect. Stephanie, did you have any other questions you wanted addressed, or
No.
are you good?
I think thank you so much for speaking to this. We're just trying to get ahead of it, anticipating there may be more activity, and just so folks, especially over the holidays, maybe have a bit of a plan and can make a game plan for their staff. So I guess just the main themes are that for these treatments, it's to start early and to ensure that the people have an updated med list, and to seek information from their doctor as a primary source, and then the hospital as a backup source. So
yes,
thank
absolutely. So especially keeping in mind that you have that 5 to 7 day window from symptom onset, and then regardless of emergency department or primary care provider, that medication list, including natural and over-the-counters, is very, very important.
Perfect. Well, thank you so much for all the information, Jory, and all the work that you guys are doing there. We appreciate it.
Sure.
Yes, thank you very much.
My pleasure.
All right, well, if there's no further questions, I guess we can adjourn this meeting. We are recording, so it'll be made available online through YouTube, and we'll send out the link to anyone who missed the meeting.
Right,
Okay.
sounds good. Thanks so
Thank
much.
you.
Thanks, everyone.
Bye.
Bye.
Bye.